Hello, welcome back to chapter 20. So we're going to move on here and keep working on this chapter, get through handout 20C is the goal here. So if we go to our PowerPoint, we left off with slide number 25. And so this just talks a little bit about cardiac muscle and how it relies on oxygen. So the heart is a very active muscle, and so it's always needing ATPs. So in order to create ATPs, of course, we learned this in chapter 3, we have to undergo cellular respiration. And so the heart will be actively producing ATPs to keep its contraction going. If there is an issue, if the heart is under stress due to lack of blood flow, it says that the heart muscle can also produce some ATP from a different source known as creatine phosphate. Now, in order for the heart to make ATPs via creatine phosphate, it has to produce an enzyme called creatine kinase. And creatine kinase is an enzyme that breaks down creatine phosphate. Now, this does not occur under normal circumstances. It will only occur when the heart is in trouble due to a heart attack. Heart attacks are known as myocardial infarctions. So this is the basic test that the ER will do to a patient where they suspect a heart attack. They will give them a creatine kinase or CK test. If there is creatine kinase in their bloodstream, they have had a heart attack because that enzyme was produced to try and keep ATP production going by breaking down creatine phosphate. So they're going to look for this creatine kinase in the bloodstream. If there's no creatine kinase, well, then the person didn't have a heart attack. So that is their basic test. Now, let's move on to the next slide because we need to go back to handout 20B and talk a little bit about an EKG, electrocardiogram. Electrocardiogram is a measurement of the conduction pathway through the heart. So we can learn a lot about the heart based on the EKG. Now, sometimes it's called an ECG. I've never heard anyone call it an ECG. Maybe you have, I have not. But it's called an EKG because the inventor of the electrocardiogram, I don't think he was from Germany, but he was a German speaker. And so cardio in German starts with a K. So that's where we get the EKG from, is because cardio is K in German. But the electrocardiogram is going to be showing us the movement of action potentials through the heart. And so this creates a couple of things. It creates some waves that are going to show depolarization and repolarization. And so it says that the P wave shows us atrial depolarization. The P to Q interval is the conduction time through the ventricles. The QRS complex is our ventricular depolarization, and our T wave is our ventricular repolarization. And so let's go to the handout here because my handout has an EKG on it. All right. Okay, so if you look at this, handout 20B, and I'm going to get rid of myself, you'll notice that there is an EKG. So the EKG is broken down into several parts. So the first part is called the P wave. The P wave shows us atrial depolarization. All right. Then we have this P to Q complex, that or interval, that is where the action potentials are spreading through the AV node to the bundle of His, to the bundle branches, Purkinje fibers, and so on. And then this big blip that is called the QRS complex, that is where the ventricles depolarize. And then we've got the T wave, which is going to be where the ventricles repolarize. Now, what's really cool about this handout, if you print it in color, everything is color coded. So you can see where the EKG is in color to how this action potential is moving through the heart. So you can see that the P wave is where the atrials depolarize, and then the red, blue, kind of gray, and brown are where the action potentials move from the AV node down the bundle of His through the bundle branches to the Purkinje fibers. And then the QRS complex is where the ventricles depolarize. And when the ventricles depolarize, they have to repolarize. The S to T interval is where we have that refractory period, that delay before we can repolarize. And then the T wave shows us repolarization of the ventricles. So this is a typical EKG. We call this a typical lead 2 EKG because it's moving from the upper right of the heart to the lower left of the heart. Now, you may notice that there's something missing. We have atrial depolarization, we have ventricular depolarization, and then we have ventricular repolarization. But there's one thing missing. Yes, it's atrial repolarization. So there's no rise in the EKG for atrial repolarization. It's actually there, it's just hidden. Because the ventricles are bigger, atrial repolarization is occurring in this QRS complex, but you just can't see it. And so the atria are repolarizing as the ventricles depolarize. So pretty sweet stuff. If we go back to our PowerPoint, you'll see on the next slide it kind of gives you some explanation. So it says in a typical lead 2 record, 3 clearly visible waves are going to show us action potential movement. So the P wave is the spread depolarization over the atria. QRS complex is the spread over the ventricles, so depolarization of the ventricles. The T wave is where we have ventricular repolarization. The one thing that you got to remember that's not on here is that atrial repolarization occurs at the same time as the ventricular depolarization. All right, so this takes care of all of Handout 20B. And so I think I'm going to stop here and I'll go into Handout 20C for our next video. All right, so I will see you soon.